Okay, so let's discuss about one important topic in general pharmacology, that is adverse drug reactions. This is most important topic as far as short note is concerned. Many short notes been asked through this adverse drug reactions, and in practical also adverse drug reaction and the PVPI has having its important. So it is important topic as far as theory and practical both concerned. Let's start with introductions. What are adverse drug events and what do you understand by adverse drug reactions? Now, these are some important terminologies that you need to remember because these are WHO definitions. So, examiner will expect that you write these definitions according to given in the standard textbook only. But let's understand the difference between these two. If I give you example, like for an example, a patient received some antibiotic drugs for 5 days and he got diarrhea on third day. So on examination it was found out that the diarrhea was because of that antibiotic. So an antibiotic was prescribed and patient developed diarrhea. Antibiotic was prescribed for 5 days. Patient developed diarrhea on third day. And one more thing, after fourth or fifth day, patient got accident. Right. So here there are two things that develop. On third day, patient got diarrhea and they found out that diarrhea is because of those antibiotic. And on fifth day, patient came across with some accident, minor accident. So here the two things that happened. First, the diarrhea that was associated with antibiotic, that doctor decided according to the clinical judgments that that diarrhea was because of this antibiotic. This is called adverse drug reactions. And on fifth day, patient met with some minor accident. So that doesn't necessarily that antibiotic induced accident. Okay, that accident might be because of antibiotic or not because of antibiotic, but it happened during the course of treatment. So that is called an event, an adverse event. So it is called adverse drug event. So that is the difference between two terminologies. Response which is noxious and unintended and which occurs in a doses which we use for any of the intentions, whether we use that dose or a drug for prophylaxis, for diagnosis, for treatment, or for modification of physiological function. For any intention, if you use any kind of drug and any noxious or unintended response happens, that is called as adverse drug reaction. So we use the drug antibiotic for treatment of infections and noxious and unintended reaction happened, that is diarrhea, and that was because of antibiotic, so it is called adverse drug reactions. But any untoward medical occurrence that may appear during the course of treatment with a pharmaceutical product but doesn't necessarily to have a causal relationship with the treatment. So here an accident happened which was untoward medical occurrence that happened during the course of treatment with antibiotic, but it was not necessarily that it's having its relationship with antibiotic only. It may be or it may not be associated with antibiotic. So it is called adverse drug event only because it happened during the course of treatment. So hope you understand the difference between these two, adverse drug reaction and adverse event now. So let's talk about adverse drug reactions. There are different types of adverse drug reactions. Type A reaction is augmented. Type B reaction, that is bizarre. Type C, that is chronic reaction. Type D, that is delayed. Type E, that is end of dose. And we'll discuss all these adverse drug reactions in brief. So let's first talk about type A reaction. Here the type A and type B reactions are also having subtypes. So we'll discuss those subtypes briefly and then we'll go through this C, D and E type. This type of reactions only you can understand with examples. So it better you understand this with examples so that on long term basis it becomes easily memorable thing. So type A reaction, that is called augmented reactions. Here type A reaction is undesirable obviously, but it is expected. So this kind of adverse drug reactions are expected. We expect that this kind of adverse drug reaction will happen with the use of drug. So it is related to pharmacological properties of a drug. So it is expected that this kind of reaction will happen, and that might be because of its pharmacological property of a drug. It's a dose dependent. If you increase the dose, there are chances that you get those adverse drug reaction. It is predictable because already those kind of adverse drug reaction we have seen in different patients. So incidence is high. There are many chances of this kind of adverse drug reactions, and the mortality is rare. But this kind of adverse drug reactions are not that much serious, so mortality chances are rare. So undesirable obviously, but expected, related to pharmacological properties, dose dependent, predictable, high incidence and less mortality are type A reactions. Now this type A reaction having three subparts or three kind of reactions. So side effects, we call side effects, is a part of type A adverse drug reaction. So one is side effects, two secondary effects, and three toxicity. So what is side effect? Side effect is a direct consequences of action of a drug. It is been observed at therapeutic doses, mild and manageable. So, for an example, if we use the drug antihistaminic, for an example, if you have heard the terminology that is cetirizine, right? We use this kind of drug medicines for anti-allergic medications. So, a lot of anti-allergic medications we use, and we use those drugs for allergy, but we get sedations. Patient gets calm. Sometimes patient gets sleepy as well. So this kind of adverse drug reaction, that is called as sedation, that is associated with promethazine or other antihistaminic medications. So this is an example of side effects, because this kind of adverse drug reaction, sedation, it is not that complicated, that is not associated with mortality much. It is mild and manageable, and it is due to its pharmacological property, because it blocks histaminic receptors, and because of this histaminic receptors blocker, there are high chances that CNS depression also can occur, and due to that patient feels sedated. So this is direct consequences of its pharmacological action, and that is why it is called as side effects. Second is secondary effects. Now, secondary effects is obviously, as the name suggests, it is an indirect consequences of pharmacological action of a drug. For an example, main thing is weakening of host defense by corticosteroids. We know that steroid is having high anti-inflammatory property. So in any kind of inflammation in the body, we use corticosteroids, and it helps reducing those inflammation. For an example, if some patient is having knee sprain, or if patient is having an ankle sprain, we use sometimes antihistaminic medications for, corticosteroid medications to decrease the inflammation of that joint. But this corticosteroid, on the other hand, decreases the immunity as well, so that the chances of other infection increases. So this is called as secondary effects. Primary effect is its anti-inflammatory effects, but here the adverse drug reaction happens due to its secondary effect, that is decreased immunity, weakening of host defense, and patient might end up with infections. So infections due to corticosteroid is secondary type of adverse drug reaction. Third is toxicity, and as the name suggests, it's an exaggerated form of side effects where it is associated with prolonged use or overdose of medications. If we use the drug in higher doses, or if we use the drug for longer period of time, there are high chances of toxicities. An example is heparin. Any examples, that is heparin, we are using it as an anticoagulant medications. So if we use this medication in a larger dose, or for a longer period of time, patient might end up with bleeding. One more example is prolonged use of steroids. One more example of corticosteroids. Corticosteroid on prolonged use produces weakening of bone mass, and that is called as osteoporosis. So these were three basic Types of type A adverse drug reactions. Type A adverse drug reaction, that is expected adverse drug reactions, mild, manageable, high incidence, less mortality, and it's having three types. One is side effects due to its pharmacological property. Secondary effects, that is its secondary effects, corticosteroid induced weakening of host defense, and third, that is toxicity because of higher dose or for longer period of time. Let's jump to type B reactions. As the word suggests, B is for bizarre reactions. So here, that these adverse drug reactions are obviously not expected. So they are undesirable but unexpected. So these are unexpected adverse drug reactions. These are not related to pharmacological properties of drugs. These are not dose dependent. These are unpredictable, and their incidence is bit less, but if it happens, there are higher chances of mortality. So it's quite opposite to type A. Type A was expected, here it is unexpected. Type A was related to pharmacological property, here it is unrelated to pharmacological property. Type A was dose dependent, here it is non-dose dependent. Type A was predictable and with high incidence, here it is unpredictable and less incidence. Type A having low or less mortality, here the chances of mortality is high, patient might die as well. So there are also three types in type B reactions. First, drug allergy. Second, genetically determined abnormal response. And third, idiosyncratic reactions. Let's talk about allergy. Now in pathology classes, you guys would be knowing that allergy is having different types. So we are not going into the detail, but example is important that drug allergy comes under this bizarre kind of adverse drug reactions. So there are basically four type of adverse drug reactions we already know: type 1, 2, 3, and 4. And depending upon the duration of development of those reactions, they've been categorized into those four types. One is called immediate type, two is called accelerated allergy, third serum sickness, and fourth delayed or cell mediated allergy. Immediate type, we already know, develops very quickly, and because of antibodies involved here are IgE antibodies. An example are anaphylactic shock with penicillin. Penicillin is an antibiotic and which is quite known for this kind of severe anaphylactic reactions where patient might develop swelling of face, eyes, lips, and also there is swelling of respiratory tract or larynx, and due to that patient feels breathing difficulty. Secondly, BP of the patient falls, and due to which patient might die as well. So immediate treatment is necessary, otherwise you may lose the patient. So penicillin is a kind of drug that is associated with this kind of anaphylactic shock, and that comes under type 1 hypersensitivity or immediate hypersensitivity reactions. So drug allergy type 1. Type 2 accelerated allergy, where it takes bit more time within 72 hours, and here the antibody gets involved, is IgG type. An example is hemolysis and thrombocytopenia. Some of the drugs produces hemolysis, especially some in patients with G6PD deficiencies, or some drug produces thrombocytopenia. This it takes some time, and especially anti-cancer medications. So this comes sometimes under accelerated allergy. Type 3, that is serum sickness, and it develops within 1 to 2 weeks. Here also IgG antibodies are involved. An example is glomerular nephritis. And type 4, that is delayed or cell mediated hypersensitivity reactions, where it takes longer time, around a month, and it sensitized T cells are involved, and it activated macrophages and granulocytes are also involved. And examples are hypersensitive pneumonitis. So you just need to remember one example and no need to go into the depth. So that was first type, hypersensitivity reactions quite associated with drugs. Second, that is genetically determined abnormal response. Now we have already seen pharmacogenetic variations in pharmacokinetic lecture. So these are some of the genetic determined abnormal response that might happen because of faulty gene, and because of that the adverse drug reactions of some drug gets exaggerated. And these are some of the example is atypical pseudocholinesterase. Now we have already discussed at that time as well that normally uh, uh, in normal patients, succinylcholine is a drug we use for muscle relaxant actions, and this succinylcholine is a very quick acting drug, and its action is terminated by the metabolism by an enzyme that is called as cholinesterase. So after some times the action of succinylcholine gets terminated, and patient again maintains normal breathing. But if the patient is having atypical pseudocholinesterase, that means if patient is having abnormal or genetically abnormal pseudocholinesterase, that takes longer time for succinylcholine to get metabolized, and succinylcholine's concentration in blood increases. So longer time muscle relaxation actions remains. So patient might having longer time of apnea. So longer apnea episodes patient might experience in this atypical pseudocholinesterase. One more example is acetylations, where there are some ethnic populations which are having a faster metabolism of drugs like isoniazid, that is mainly used for tuberculosis, and this isoniazid metabolism is occurs by acetylations. So if the patient is having fast acetylator status, means the metabolism of this isoniazid is faster, then it becomes more its metabolite, and that leads to hepatotoxicity because their metabolites are quite hepatotoxic. And if in some patients slow acetylators, means the metabolism is slow, there are high chances that isoniazid concentration increases in a blood, and that leads to peripheral neuritis, side effects of isoniazid. So if so normal acetylator status is necessary. If the acetylator status or the metabolism fast, that can create some types of adverse drug reaction. If the metabolism is slow, that can lead to other type of adverse drug reactions. So depending upon the abnormal status of metabolism, adverse drug reactions can occur. And one more example is G6PD deficiencies. Patients who's having deficiencies G6PD enzyme, they are more prone to hemolysis by some of the drugs. Example is sulfonamide, which is an antibiotic medications. And if we give this sulfonamide in some G6PD deficient patient, there are high chances that patient end up with hemolysis. So these are some genetically determined abnormal responses. So that is why it is very important to pharmacogenetically evaluate a patient and decide the treatment accordingly. And lastly, idiosyncratic drug response. Now, what do you understand by idiosyncratic means? Idiosyncratic means you don't know the exact mechanism how this thing happens. That is idiosyncrasy. So, if those adverse drug reactions happens, you just need to expect. These are very rare adverse drug reactions, and that can happen with drug. But how and by what mechanism that develops, that is not very clear, and that is why it has been categorized under this idiosyncratic drug response. These are harmful and fatal. The causes are not known. The examples are malignant hyperthermia by halothane. Halothane is an anesthetic agent, and in some patient, if you give this halothane, there are high chances that patient end up with malignant hyperthermia. That patient may undergoes the convulsion-like state. All the muscles get contracted, muscles get damaged, kidney gets damaged. Patient is having higher temperature, so it's a very emergency situations, and you need to treat them. Same way, chloramphenicol is an antibiotic drug, and it can lead to aplastic anemia, which is quite dangerous situations. So this kind of reactions, why this kind of reaction happens and by which mechanism happens, it's still unknown, and that is why it has been categorized under idiosyncratic drug responses. Now let's jump to type C, that is chronic adverse drug reaction. As the name suggests, if you introduce the medicine for longer time, so prolonged use of a drug that lead to some kind of adverse drug reaction, that is called as chronic adverse drug reactions. Example is glucocorticoids. If you use glucocorticoids for longer time, that leads to Cushing syndrome, and we'll see in detail in that chapter. Chlorpromazine, that is antipsychotic medications. then if you use these antipsychotic medications for longer time, there are chances of some abnormal movements that are called as tardive dyskinesia. Let's jump to delayed type of hypersensitivity, that is more longer than the chronic. So that adverse drug reaction occurs after years of exposure, and the examples are cancers to patients exposed to alkylating agents. Some of these alkylating agents we use in some of these alkylating agents are the anti-cancer medications, and they are basically used to treat some cancers, but they that might end up with another type of cancer development. So cancer due to anti-cancer drugs that occurs due to years of exposure, and that comes under delay type of hypersensitivity. And congenital malformations in fetus due to exposure of drug during the pregnancy. If patient gets exposed during the pregnancy due to some of the drugs, that then they might end up with the child being deformed, and that is considered as congenital malformation, though that comes under delayed type of adverse drug reactions. Type E, that is end of dose. uh, this is one kind of adverse drug reactions. Type E, that is end of dose adverse drug reactions, when you suddenly discontinue the drug, especially that occurs with the drugs like clonidine. Clonidine we will see in detail in the chapter of autonomic nervous system. And this clonidine is basically used for the treatment of hypertension. And if we use this drug for a long time basis, there are chances sometimes we miss this drug. And if the patient misses the drug, there are chances of sudden high blood pressure. So patient's blood pressure increases suddenly, because if the patient misses the dose of these drugs, and this can lead to a hypertensive crisis, and that is called as end of dose adverse drug reaction. So sudden discontinuation or sudden missing of a drug, that can lead to end of dose adverse drug reactions. One more example is anti-epileptics. If we suddenly stop anti-epileptic medication, if patient is on anti-epileptic medicines for convulsions, and he or she suddenly stops the medications, that can lead to rebound attack of epilepsy.